So here we are. There is some good news on the Colorado front. Our numbers appear to have peaked after the Thanksgiving exposure, and so we're trending, on our way down again after the Thanksgiving holiday. As we all know, Christmas is coming, and we do expect another peak associated with that. So hopefully we'll have a little reprieve here to help our hospital systems get some patients out of the hospital, increased bed availability in anticipation of an enormous surge with Christmas again, as we did see with Thanksgiving. The positivity rate has also come down in Colorado, and so of all the tests, there are slightly less folks who are testing positive than they did last week, which is great news, meaning that less folks are congregating together now that the holiday has passed. There are a few glimmers of hope. It's not all dark brown. There are some counties here in Colorado that do have a decrease in their positivity rate. Unfortunately, that's not us, but there are some, so some is better than none. Hospitalizations in Colorado have decreased slightly, so we can take a little bit of a breather, knowing that we're not heading upwards anymore, and that there are more beds available in Colorado. So when folks get really sick up here, they need to be transferred. We do have the opportunity on the Front Range to send them elsewhere. Our hospital, we have 6 inpatients, and so we are full-ish. We can always surge into more if we need to. But our mission over the past several weeks was to help alleviate our hospitals around us, and so we can take patients that are not cardiovascularly compromised from them, so that they can have more bed availability at the lower altitudes. And that program is working well. We've been able to at least help some with our neighbors, which is great news for us. The death rate, follows cases. And so, I expect that the death rate in Colorado will continue to escalate over the next week or two as it catches up with the folks who have been infected with the virus. Our local data, again, continues to mirror what happens in the state. We've got a ton of people who are infected. Lots of folks are getting their infections, and almost all of them, honestly, are from home. So the small gatherings or in family units where people come to others' homes, lower their guard, take their masks off, and then they become infected. The good news is that we're not seeing much transmission in businesses. We're not seeing them in transmission in medical facilities, schools. We're not seeing much transmission in schools. And so, where places are following guidelines, where they're wearing their masks, they're washing their hands, and they're staying away from one another, we're doing a good job. So, kudos to us in the business sector for really doing what we need to protect our customers and our patients. Our positivity rate has also come down a smidge, which again is great. We still see lots of people getting tested, but the amount of people that are positive in those tests are low. We are offering molecular rapid testing all over, so you can get a rapid test wherever you need to at St. Vincent's Hospital or Rocky Mountain Family Practice, and you just walk in for those. So there's lots of availability, and we're encouraging people to be tested. You think about getting tested, get tested. It's really our only way to help contain infections. And so if you're positive, hopefully you do the right thing, quarantine and stay away from others. The CDC did publish new guidelines a couple weeks ago about quarantine, decreasing the length of time. It's become more obvious as we learn more and more about the virus that you don't have to quarantine for 14 days as much anymore, and we can certainly get you out of quarantine in 7 days. If you've had an exposure, you come in on day 5, 6, or 7 and have a rapid test that is negative, you can return to school or work. So please do talk to your healthcare providers about that so that we can keep our economy moving. Total cases, not great. We are well over 350 cases in Lake County. Hospitalizations for COVID specifically is here, and so we do have a patient on the floor who has had COVID, and so our hospitalization numbers for COVID are still there, but remember that our census is now 6 on the floor with patients who have other issues. So it just feels good to have a full hospital, to be able to help our community in need. The numbers are here. The Colorado positivity rate is dipped below 10% for the first time in many, many weeks. Unfortunately, still here in Lake County, we're quite high at 17%, but it's less than it was last week, so we'll celebrate that. But we have had 75 positive cases in the past 2 weeks coming out of St. Vincent's and Rocky Mountain Family Practice. That number is higher as other folks are leaving the county to be tested elsewhere, Summit County, for example. And then, of course, yeah, our favorite slide, hopefully that continues, that there are no Lake County residents that we know of who have died from COVID. I know that there have been some questions about, why is Lake County, so fortunate that we haven't had any Lake County residents that have died. And who knows, I have my own theories whether they're, whether they're scientifically based or not, I don't think so, but I have my own theories. But there have been tourists who come and visit who have gotten COVID in Lake County who have been transported down to Front Range hospitals, unfortunately have died. So, we're not completely immune, but those of us who have a residence here, there have been no reported deaths for those of us. So the vaccine rollout, again, very, very exciting. And it is the end to the pandemic, folks. I say that with complete confidence. I am taking my little show out to communities that want to learn about the vaccine. And so this next week, I'm hitting medical communities, first responders, those of us who are in that first tier of vaccinations. And convincing everyone, presenting the data, showing people how the vaccine was made, what remarkable technology, why it was produced so fast, why it's safe and why it's efficacious, and then of course how important it is that all of us get vaccinated. If all of us don't get vaccinated, we have no herd immunity, and the pandemic will go on forever, for years. And so the vaccination piece is very, very important. As we learn about getting vaccines, for everybody, I will take that presentation to anyone who wants to listen to it. So I will ask for folks to ask me to come and speak to your churches, your school groups, whoever out there there is, again, when it gets closer to the time that we have more vaccine availability. So that's all I formally have. I see some stuff happening in the chat. I'm not sure if that was for me or not.
Lisa, I read something about, this is Christine. I read something somewhere, you know how it is, that you maybe want to take a day off work the next day after the vaccine. I mean, it does kind of hit some people kind of hard.
Yeah,
more than the flu vaccine.
Vaccine side effects. So you should be fortunate if you have vaccine side effects. That tells you that your immune system is working and the vaccine is doing what it's supposed to be doing. And so after you get a vaccine, you're supposed to feel some side effects. It's supposed to hurt at the injection site. You should feel a little achy. Maybe you have a low-grade fever. And so as healthcare workers, what we're grappling with now is as we take the vaccine, do we all want to get the vaccine all on the same day, knowing that the next day we might feel a little achy, right? We might have a low-grade fever. And then of course, knowing that, COVID is still circulating in influenza and, RSV and all of the other viruses that circulate this time of year, how do we know that we're not sick with those? So that's the hard decision. And so I think, the hospital obviously will make their own decisions. But I think what will happen for most of us is we'll stagger vaccinations amongst healthcare workers and first responders, where we, some of us get it on day one and then some of us get it on day two. And so if there are people who do feel too sick to come to work, then, we won't do that. But please remember, vaccines trick your immune system to think you've been infected with something. And so you should have a reaction. If you don't, that doesn't speak well for your immune system.
And I also saw something about a very, very small percentage, like 3 or 4 people having some temporary facial paralysis, like akin to Bell's palsy.
Yeah.
That has gone away. And, having gone through chemo many years ago, my oncologist told me to avoid the live shingles vaccine. Is this a live vaccine?
No, the technology that went into manufacturing of this vaccine is extraordinary. And, human scientists are just so smart. Essentially what they did is they isolated some of the genetic material that the virus makes. So not the DNA, and certainly, it's important to understand the difference between DNA and messenger RNA. But without, boring everyone, essentially what we've done is we've taken a piece of this messenger RNA, encapsulated it into a blob of lipid, so fat, and that's the vaccine. And so it is not a virus. It is not a dead attenuated virus. It's not part of the virus. It's just part of the protein encoding genetic material from the virus that goes into your cells. Your cells start making the protein that this mRNA is encoded to do, and that's the little spiky protein that's on the outside of every coronavirus. And so your body recognizes that as foreign, and you have an immune response to that. The thing that we don't know is that, every coronavirus has this spiky protein on the outside of it. So, the common cold is a coronavirus too. and, for millennia, right, we've been talking about the cure for the common cold, and we all are just kind of wondering, will this vaccine decrease overall colds in general as well? So, and again, please invite me to your groups. I am happy to do an in-depth conversation with whoever wants to listen to me about how the vaccine is made, why it is safe, how you don't have to worry about becoming infected with coronavirus if you take the vaccine.
We should still be wearing masks, though, right? Even after.
Absolutely, because we can't vaccinate everybody at once.
Right.
If we had 300 million vaccines to give everybody all at once, then no, we wouldn't have to wear a mask. But we just don't have that ability to vaccinate everyone that quickly. But once everyone is vaccinated, and again, hoping that everybody does, we need 75% of us to be vaccinated. If that happens, then yes, no more masks. Yay. No more socially distancing. We can have parties again. This is, such an enormous thing for us as humans that we get to socially congregate again. But the only way that's going to happen is if we all get vaccinated.
Thank you.
Yes, ma'am.
I have a question, Dr. Lisa, and thank you for your weekly updates and presentations, as they're very helpful. But what about the likelihood of somebody contracting COVID a second time?
Yeah, that absolutely happens. It's the common cold virus, right? So you think about how many colds you've had in your lifetime. It happens. Viruses also, mutate. And so, there have been several people in Lake County that I know personally that I've taken care of that have had COVID, and then they've had a period of wellness that's longer than 3 months, and then they've gotten sick again. So it happens.
Well, Dr. Lisa, thank you very much for your weekly updates.